Good evening. Hello, everybody. Welcome to the webinar, Firearm Safety and Suicide Prevention. We'll get started here in just a moment, but we're really happy to have you and thank you for spending your dinner hour with us. Really appreciate it. Well, we're going to get started right now. I know people are still joining as we're just hitting the 6 o'clock hour, but we certainly have a lot of information to cover. We want to make sure we get through it and that we also have time for your questions. So again, I'm Brian Malty. I am Executive Director of the Hope and Heal Fund. We are a California-based funder advancing innovative solutions to reduce harm and trauma due to violence and suicide with a key focus on the lethal means of harm, which are firearms. In a few minutes, we'll start our presentation. But first, I want to welcome all the members of NAMI who have joined us. Speaking from Hope and Heal, and I know the Office of Violence Prevention in Los Angeles County, it's a real privilege and an honor to be with you all and standing alongside you all for this really important work. I want to talk a little bit about housekeeping, just kind of what we're going to be listening to, the presentations, and how you can participate. So again, we'll have a lot to cover, but we're going to save time at the very end for Q&A. And if you have a question, please make sure you put it in the Q&A box at the bottom. That's really important. And we'll be collecting your questions as we move along, and we'll try to get to as many as we can. So make sure anytime during any of the presentations, even starting now, let us know your questions. And like I said, we'll be getting to those. I also want to state that tonight's topic can be challenging. So please practice self-care. Also, NAMI of Greater LA County and Trouty, who will be talking very soon, will be talking about the warm line, and that'll be available. And she'll share more in a bit. We'll also be recording this session, and that is to make sure that we make sure that maybe those who weren't able to join us can view the webinar and get something out of it, right? So first of all, thank you to NAMI of Greater Los Angeles. Thank you, Trouty Winters, who's Executive Director of NAMI Greater LA, for making this possible. Our job today is to provide information about the tools to keep our loved ones safe, as well as our communities. The overall theme of the presentation really is about caring for people, the ones we love, and creating awareness about the risks that firearms pose to our friends and our families. And today we'll hear from, of course, NAMI Greater LA, Trouty, very soon, and she'll tell us a little bit more about the services and those that'll be available to all of you. And we're also really appreciative to have Andrea Welsing from Los Angeles County Department of Public Health of the Office of Violence Prevention. She'll share more about the Office of Violence Prevention and the focus areas and resources. And again, just to reiterate, we'll take your questions. So please, if you just joined us, the Q&A box, I believe, is at the bottom. Please give us your questions as we move along, and we'll try to get it to as many as possible. And again, thank you for joining us, and thank you for spending your dinner time with us. So with that, I'm going to pass it over to Trouty Winters, and she'll take it from there, and then I'll be back with part of the presentation, and then Andrea will be back as well. So thanks a lot, Trouty. It's all yours.
Hi, everyone. Thank you for joining us this evening. Again, I'm the Executive Director for NAMI Greater LA County, and I've been here for about 4 years. Prior to joining NAMI, I worked at the American Foundation for Suicide Prevention for 6 years, where I was the Los Angeles and Central Coast Area Director. I want to turn the presentation over to Donnell DeRubis, who is our NAMI Greater LA County CalHOPE Warm Line Supervisor, to talk a little bit about that resource that we have available to you.
Absolutely. Thank you, Trouty. Hello, everyone. I am Donnell DeRubis, as Trouty mentioned. I am honored to be a part of the Connect with Hope Warm Line team. I am one of a few peer support specialists that are there for our community not only tonight, but in the future. We are available Monday through Friday from 10 a.m. to 8 p.m. Pacific Standard Time. You can reach us by dialing 818-208-1801. And tonight in particular, I know that this topic can be heavy. So if you are feeling that you need support and just want to talk with somebody, please do not hesitate to reach out. I am actually available and I will be there to pick up the call. We could chat through and just be there to support you. And of course, again, in the future, if you are looking for emotional support, if you're looking for resources in the greater Los Angeles County area, please do not hesitate to use our warm line. We would be more than happy to be there and support you.
Thank you, Donnell, and Brian, I'll turn it back over to you.
Wonderful. Well, Trouty, do you want to go ahead and do your presentation?
Oh, you want me to do mine
Yes.
first? Okay, sure.
Yes, please go. It's all yours.
Okay, sounds good. Okay, thank you again. I'm going to take you through a little bit of information about NAMI Greater LA County, and then we'll get into some resources and a little bit of information around suicide and prevention. We're the nation's largest leading mental health grassroots organization, and here in LA County, we're the leading countywide organization. We are comprised of 6 chapters in LA County, and we offer wellness, recovery, equality, and dignity for individuals and families that are impacted by mental illness. And we provide leadership in advocacy, education, support, public awareness throughout the county. These are the chapters that are underneath our umbrella. So we have NAMI National, and they design all of our signature programs. We're NAMI Greater LA County. There's also NAMI California. Every state of NAMI has a statewide organization. And then these are the chapters underneath our umbrella: NAMI Glendale, San Fernando Valley, South Bay, San Gabriel Valley. We have Long Beach and Whittier, and Pomona Valley. And then there's 2 other NAMI chapters within LA County: NAMI Westside LA and NAMI Urban LA. Little bit about our programs. We have support groups throughout LA County. If you go to our website, namiglac.org, you'll see almost every day of the week there is a support group either in person or online in LA County. And our support groups are both family support groups. So for families and those who support someone with a mental health condition, they're peer run by family members that are highly trained. We also offer them in Spanish. We have Japanese support group, LGBTQ plus support groups, and faith-based support groups. And this year, we're also looking to start additional support groups for other communities. We have NAMI Connection support groups that are for those who live with a mental health condition. That's also available in Spanish. And we have LGBTQ plus and women of color and non-binary women support groups as well. Our education classes are family to family in English and Spanish for family members and others who support someone. It helps them gain a better understanding of mental health conditions, how to advocate for their loved one. And then NAMI Basics specifically is very similar, but for parents who support someone living with a mental health condition. We have a peer-to-peer 8-week class for adults living with a mental health condition who are looking to better understand their recovery and themselves. And it is led by people who live with a mental health condition, so people with lived experience. And that is also available in Spanish. NAMI Friends and Family is a 90-minute presentation version of family to family for people who may not have the time for an 8-week class, or it's a good introduction as well. And I should say all of our programs that we have, our signature programs, classes, and support groups are free of charge to the community. Ending the Silence is a program we have in schools for middle and high school students. It's also a suicide prevention program. And In Our Own Voice is a program that we can do in the community to any organization where we have folks providing a personal perspective of what it's like to live with a mental health condition. We also do training both with LAPD and the Sheriff's Department. We're part of crisis intervention training, where we bring in the family and the individual experience of folks who may have been justice involved and what it's like to live with a mental health condition or a family member. And they'll use stories to help increase officers' understanding and empathy and how to engage with someone who may be struggling with a mental health condition. In terms of advocacy, we're really building our advocacy area at this time, and we are wanting to be the leading voice on mental health policy and issues in LA County. And so if that's something you're interested, please go to our website, namiglac.org, and we'd love to have you join our advocacy. And some of our priorities are to advocate that we have a robust mental health workforce capable of meeting the community's needs. Unfortunately, there is a shortage of mental health professionals right now in our country, and that's something we're advocating for, programs to bring folks into the mental health field, particularly in public mental health. Also increasing treatment beds at all levels of continuum of care. And now in California, substance use disorder is combining with mental health to become the behavioral health infrastructure in California. So we'll be working together with the substance use community to see how we can bring the best treatment in our county forward. In terms of criminal justice, we advocate for more equitable treatment and diversion programs. LA County jails are known as the largest mental health institution in the country. We're advocating for building of non-carceral treatment facilities. Also with housing and homelessness, making sure that folks with mental illness are getting the support and the housing at all levels of care. So that's, a priority that we still have some work to do in our county. And really engaging, again, individuals in our advocacy efforts. So some of the advocacy initiatives that in California, we have been working on Proposition 1, which passed last year, and that will become effective July of next year. And that's going to bring a lot of new housing and treatment into California and our county. So we're part of the planning for the county's budget spending on those dollars. Care Court is something that started a year ago, and it's for people who live with severe mental illness, the psychosis, for family members and others to petition for them to get intervention and much needed support and care. SB 43 will modernize the gravely disabled conservatorship, the LPS Act, to meet the needs of individuals not just experiencing mental illness, but it now also incorporates substance use disorder. That will go into effect in January of next year, and we're in stakeholder meetings with the counties on that. And then Measure A passed this past November, and that increases the sales tax to bring more services and housing to people exiting homelessness. So we're advocating to make sure that the programs are put in place for that. As I mentioned, criminal justice reform, building of non-carceral treatments. You see, we do the crisis intervention training, and we're involved with the county planning of the Prop 1, the behavioral health services funding and the housing. Okay, so Donnell mentioned our warm line, which I want to mention again, and we also have helplines within each of our chapters. And the difference between a helpline and a warm line, a helpline primarily will offer you resources. The warm line goes a step further in terms of, you're just having a bad day, you need someone to talk to, you're struggling with anxiety or depression. Our peer support specialists will support you with the needs that you have, or just there to listen. They'll research different resources that might be good for you, connect you with our NAMI programs. So this is a great service that we're pleased to offer the community. So hopefully, if you need our support, you will take this number down and this email down as a resource. And I also want to mention 988, which is, hopefully everyone is aware of that. It used to be the Suicide Prevention Lifeline. Now it's Suicide and Crisis Lifeline. It's gone to a 8988 3-digit number versus a long 800 number that's hard for people to remember. And it's staffed 24/7, and it provides free confidential resources to people experiencing or affected by suicide, mental health, or substance use crisis. You can call or text. And even if you want to call on behalf of a friend or with a friend, or you're a family member not sure how to support a friend or another family member, call 988 and they can guide you through. You're going to hear a lot of information today. And, if you need some assistance with how to support someone, 988 is a good number to call in addition to our warm line. But if you're in crisis or someone's in crisis, 988 is definitely the number to call. And we're very fortunate in LA County. We have Dee Dee Hirsch, who runs our 988 line here. They work very closely with the LA County Department of Mental Health to support individuals who need that support. And most of the calls, 97%, are de-escalated, but the 3% that may need someone to come out, they will coordinate those services. And I was asked to talk a little bit about how should we talk about suicide, because that's very important. If we're talking about suicide or a suicide attempt, it's important to not talk about the lethal means or methods used, because research has shown that that could cause contagion. And what contagion is, for example, in Palo Alto a few years ago, there was a contagion aspect where one student died by suicide and then several others in a close time frame did. When Robin Williams died by suicide, the media reported on the method he used, and that method then for a few months increased. So it's very important that how we talk about suicide so that we don't promote contagion and that people get support. So if a school has a suicide, that's being addressed, and others who might be struggling get the support they need. Also, avoid using the word committed, which perpetuates the stigma of suicide as a crime. Instead, it's good to use the words died by suicide, took his or her life, or ended one's life. And also not to refer to a suicide as successful or unsuccessful or a failed attempt. We just, don't want to use that kind of language. So we also developed some trauma resources that our national office was very helpful in developing these when we had the wildfires, and we know, that those impacted our are going to need these for a while. Our warm line is one of those, but SAMHSA also has a crisis line 24/7 that if someone has experienced trauma, they can call that number and get support. And we also have other resources, both local, county, as national resources, and you can see the URL right here. And then I just want to put in a big announcement for our NAMI walks coming up on May 10th. There's no cost to register. It's the largest mental health event in LA County. It's a walk and mental health festival. We have a great program, great speakers. It's a fun day, lots of activities. So hopefully you will join us. And then, if we'd love to have any volunteers as well. Again, you can go to our website, namiglac.org. And, we're here to support you. So please reach out if we can be of any support. Thank you.
Thank you, Trouty. Really appreciate it. And great resources. So really appreciative of your presentation and all the resources that NAMI provides. I know we're getting my presentation all lined up here while that's happening. Just a reminder for folks who joined us, may have joined us late, a reminder to please submit your questions in the Q&A. We want to hear from you. We're trying to make sure, even though we're running through a lot of information, to make sure that we have time to answer your questions and really try to get into a little discussion. So, but with that, again, for those of you who maybe joined a little late, my name is Brian Malty. I'm the Executive Director of the Hope and Heal Fund. We're a California-based fund focused on the sort of public health, race equity, and intersectional approach to harm from firearms. So next slide. So just a little bit about our framework. We're a little bit different. I used to work at the Brady organization, and of course, there's a lot of focus on legislation. That's not something we focus on primarily at Hope and Heal Fund. I want to talk a little bit about our framework because I think our framework is really important because it's a really holistic way of looking at harm from firearms. So what are we talking here? We're talking prevention, intervention, mitigation, trauma healing, and aftercare. I think is something that is not for someone like myself who's been in sort of the gun violence prevention movement for 30 years is not something in the past decades we've really talked a lot about. So while we focus on the underlying root causes of violence, which is really important, we also have to address the most lethal means of violence, which is easy access to firearms. And again, we'll talk a little bit more about that. When we're talking about easy access to firearms, I think there's a couple of things to point out. One is the ease at which young people and others in the community can access guns on the street, and the ease, unfortunately, of accessing guns in the home. So when you're thinking of easy gun access, when we talk about that, it's out in the community and it's in the home. And I think it's also important for Hope and Heal Fund is that we highlight data. We're a very data-driven organization. We want to know the statistics. We want to know the statistics down to the block level, the city level, especially on homicides. And we'll show you a little bit later kind of what we mean by that. And we've done a lot of GIS mapping, heat mapping on this subject. But it's also important to talk about the cost of firearms and suicides to the community, loss of wages, cost of incarceration, lots of different costs. And it's really important when we're talking about violence and suicide, sort of the loss, the cost of firearm homicides and suicides. Next slide. So talk about firearm safety, suicide, and mental health. Someone, again, who worked at the Brady organization for a lot of years and seeing how the media portrays violence. We do know that media accounts of mass shootings reinforce the belief that mental illness often results in violence. And a lot of us know, right, that having a mental illness is not a precursor to violence. Even though what we see, what we read a lot about is that is the case. So I think it's really important. And again, because mass shootings do occupy, they're horrible and tragic. They do occupy a lot of the media. And we need to make sure that we push back on the fact that those with mental illness are, you know, often results in violence, which is not the case. We do know that studies show the vast majority of people with serious mental illnesses are never violent, like we talked about, but could be a precursor to suicidality. Next slide. So, like we're talking about, but is a predictor of suicide. Depression is a leading cause of disability globally. The vast majority of people with mental illnesses are not violent, as we talked about. Suicide is correlated with depression, and firearm deaths associated with mental illness are nearly always suicides. I mean, I think that's what's important. That, to me, and we've done some working with Berkeley Media Studies Group, we've done really looking at the media and how they report. And that's something afterwards, after we're done with the webinar, we can send, there's a messaging guide that talks about sort of how, like Trouty, you mentioned how to talk about suicide, what you say, what you don't say. We also work with a lot of experts and researchers and folks that are experts in suicide and firearm suicide about messaging. And we have a really good messaging guide that really helps not only advocates, but journalists talk about that too. So I think there's also a way for us to work within the media to do narrative change to make sure that folks understand that mental illness is not a precursor to violence, but is a precursor perhaps to self-harm. Next slide. So community and firearms, one thing we know is that, first of all, we know that women and girls attempt suicide more often than men, but men die more often than women. And typically it's because there are more firearm owners who are men. And so what happens is you rarely get a second chance. We know that about 90% of the time, 9 in 10 times, that if you use a firearm in a suicide attempt, you will not survive. So I know this is really difficult and challenging stuff to talk about, but it's really important because if we can figure out ways to make sure that folks do not have access to a firearm in a time of crisis, we can save a lot of lives. So what that means too is living in a home with a firearm owner, right? That it's not just the firearm owner, which is true, is someone who could be in crisis, the owner themselves, but it's those living with the firearm owner who may not be firearm owners themselves, right? Could be the children, could be the teens, it could be a spouse or a partner, right? And the other thing that's really important, I know this is not the subject of this webinar, but we also are focused on, we have really, there are three major forms of firearm violence and suicide. One is suicide, the other is homicides, and the other is domestic violence. So just saying that when you bring a firearm into the home, we'll talk a little bit about safe storage and strategies. It's really important to make sure that that firearm is securely locked up. Next slide. So contributing factors in terms of firearm risk, right? We know trauma, and we talked about that earlier, is that our organization really looks at addressing trauma and aftercare, but also in a very cultural way. We're at the heart of it, we're a race equity organization, and it's really important to meet people where they're at culturally. But at the bottom line is, you don't ever have to been shot or shot at to suffer trauma, which you will, but just growing up in a neighborhood or being exposed to a lot of violence, that's trauma, right? And I think it's really important, and it's important to Hope and Heal Fund that we address that. We all know about bullying, right? Bullying, access to firearms is also a contributing factor. Dehumanization, normalizing the taking of a life, right? And especially when we're talking about homicides, that's not normal, and we cannot normalize that. We have to find ways to make sure that we humanize every life. Again, we talked about gun trafficking and firearm access in the home. Again, I can't stress this enough, that there are strategies, I will just say, that we work on and we're working on now to decrease the supply of guns that are available in the community. And again, we talked about and we'll talk more about the strategies to make sure that if there's a firearm in the home that's securely stored in a way that an unauthorized user is not able to access it. And one more thing before we move on is at the end here, we talk about school shooting risk is, while public mass shootings are about 1% of all gun deaths, we know that about 80 to 85% of all public mass shootings, the gun was obtained from the home. So just to underscore not only the suicide risk, but also the mass shooting risk. That is just another good reason to make sure guns are safely secured. Next slide. Contributing factors underlying mental health condition, untreated trauma, alcohol, and drug use. One thing we do find from researchers is that one of the precursors to a firearm suicide attempt is not only, of course, having a firearm, but alcohol and drug use, right? So that's really something that we pay close attention to: a precipitating event, conflict, again, access to firearms. And then in terms of public and mental health wellness systems, we're not, we're sort of scouring sort of county behavioral health systems, private hospitals, lots. We're not finding, and we'll talk about this just a second, we're not finding a lot of policies or protocols thus far where there's screening, I say mental health screening protocols for firearm access at the front end of assessments. They may exist. Some of you may know that those policies are in place, or your pediatrician or somebody else may do that, but it's still very few and far between. And I think that's an opportunity, which we'll talk about in just a second, opportunity for all of us to save a lot of lives. Next slide. Interpersonal interventions and strategies. Of course, there's counseling, formal and informal resources and supports, a lot of supports, Trouty, that you talked about. Again, protocols, we'll show that in a second, right? What are screening protocols for mental health systems to make sure that they're asking about the most lethal means of suicide, which is the firearm. Providing safe storage information, like if you're a new firearm owner, and one thing we found out here in California and across the country is that during the COVID pandemic, there was a surge in gun sales. Not only just a surge in gun sales for those who already had firearms, but during the pandemic, this is from UC Davis, found out that about almost half of the guns sold during the pandemic, this gun sales surge, about 43% were first-time gun buyers. Half of those first-time gun buyers are women, and about a quarter of them are communities of color, people representing communities of color. So what you have is you do have a lot of Californians now who are first-time gun owners who may not know how to store a gun safely. And so it's critically important that we look at that. The other thing I will just say too is typically, because most gun owners historically have been white males, you see that show up in the statistics that's when there's a suicide, a firearm suicide, typically it's a white male. We're seeing that percentage though drop. And unfortunately, what we're seeing the percentages increase are young African-American males, folks in the AAPI community, Latino men. So we're seeing this gun sales surge, but also we're seeing a surge in sort of non-white male firearm suicide. So it's something really to pay attention to. So equity plays a big piece in this as well. Providing gun safety locks. I know Andrea, when she talks, she'll talk a little bit more about that, what's happening in LA County. And she'll also talk about gun violence restraining orders, right? Gun violence restraining orders are now available in California. They have been since 2016. Although most people don't know what a gun violence restraining order is, that's something a Hope and Heal Fund is working on, the Office of Violence Prevention, and Andrea will talk a little bit more about that. Next slide. Again, don't want to go too deeply into this right now, but if you visit our website, which is hopeandhealfund.org, at the very bottom of the homepage, you'll see maps, and you'll see sort of maps down to the neighborhood level where homicides occur, firearm homicides occur, down to the street level. But you also will find on a county basis the level of firearm homicides and the firearm suicides in each county as well, which is, I think, really important. And that's part of our being data-driven for us. Next slide. So this will be something I think you can dig in because we'll make the slides available a little bit more. We worked with the California Institute for Behavioral Health Solutions on developing, you'd call it a decision tree, but you could also call it sort of interim protocols. These are the protocols that I was remarking earlier that we're not really finding in a lot of county behavioral health systems or private hospital systems. That is screening on the front end of an assessment if someone has access to a firearm, someone in crisis. So we think it's really important to do that. And of course, you can't read all this, but we'll send this out and you could take a little bit more. And of course, we're always available to answer questions or to kind of walk you through this a little bit more. So just know that this is a resource. Next slide. And again, I know we've talked about this before, Trouty talked about this, but just a reminder of all the LA County resources. I don't think we can show this slide enough. But next slide. Well, that's all my slides. Thank you. I really appreciate the time. We're going to pass it over to Andrea Welsing from the Office of Violence Prevention. She can introduce herself. We'll then save some time at the end, and I'll be moderating questions. So again, please get your questions in at the bottom in the Q&A box, and we'll go from there. Andrea, it is all yours.
Thank you, Brian. Can someone help pull up my slides for me? Thank you very much. So my name is Andrea Welsing, and I am the director of the Los Angeles County Office of Violence Prevention that's housed in the Department of Public Health. And I've been director with that office pretty much since its inception in 2019. I've been with the county since 2013. And before that, I worked for healthcare systems for 10 years. Tonight, I want to share a little bit about the Office of Violence Prevention, our implementation priorities, and a little bit of the data that we collect around firearm deaths and injuries. And most importantly, I want to share sort of what we're doing around gun violence prevention and the resources that we have to share with you. So we really are your Los Angeles County Office of Violence Prevention. We are here to support and serve you in any way. Before I dive in, I know you had this previously, but I just want to again say that my presentation includes language and data about firearm violence. And so just to take care or access the NAMI warm line as needed or take a pause or a minute. Next slide, please. So the Office of Violence Prevention was established in 2019 by the Board of Supervisors with budget and staffing to implement priorities and create a strategic plan around the prevention of violence in LA County. And really what we do is we acknowledge that there's a lot of good violence prevention work already going on. So our role we see is really to strengthen collaboration, capacity, and partnerships to prevent all forms of violence, whether it be gun violence, domestic violence, just suicide, to prevent all forms of violence and to promote healing across communities in LA County. We are governed by a county leadership committee and a community partnership council who oversee and guide and inform our work. And we really appreciate that. They hold us accountable and they help to inform our efforts and then also take that work out to their networks and connections. Next slide, please. Our implementation priorities when we first were established really rotated around 6 different priorities. So LA County is huge, it's vast, 10 million plus residents, huge geography. And the way we really see ourselves doing this work is local and place-based and informed by community leaders and survivors who are most impacted. So to that extent, we part of the work of our office was to establish regional violence prevention councils, coalitions in each service planning area, which breaks up community into a little bit smaller areas. And we fund a local CBO to lead that work in each community. We have access to a lot of data in public health. We have access to the medical examiner reports, to law enforcement reports, to hospitalization data. And we want to share that data with others to help inform their work. And so we have created an open data portal that's available on our website. I'll give that website at the end. But you can ask us for any kind of data that you're interested in, as long as it's related to violence. And we can help provide those numbers to you so that you can understand who's most impacted and where. What are the populations? What are the geographies? We have a trauma prevention initiative, which really focuses on gun violence, gang violence, community violence. We have a crisis response pilot that we have only in South LA at this time. But whenever there's a crisis, there's a team that responds to that incident and provides support for the community. We really recognize that part of violence prevention is that healing component that you heard others reference, Brian and Trouty. So we advance trauma-informed care systems change with principally among our county systems, but also in community. And we have resources along that line as well. And then we recognize that a really important part of our work is shifting the narrative about violence and trauma. And so we have a communication strategist, and we work hard to proactively message about violence prevention and uplift the work that's going on in communities and the impact of the work that we're doing. Next slide, please. Since we were established in 2019, the board has put 3 additional initiatives under the umbrella of the Office of Violence Prevention. And these are all new starting in 2024, but we're establishing a sexual assault council to address sexual violence in LA County. We have a gender-based violence prevention initiative, and that will focus on gender-based violence, including sexual violence, intimate partner violence, hate crimes, and trafficking. And then it will invest funding to help prevent violence upstream. And we had a grant from the California Department of Public Health, $5 million grant to focus on youth suicide prevention. That grant ends in June of this year, but a lot of good work is being done as a result of that, including work around surveillance and really providing data in real time about suicides and suicide attempts. Next slide, please. So our role in public health is really, we have a focus on prevention. We want to address root causes of violence, and that really means looking at things of making sure that communities have access to the resources and services that they need, transportation, adequate income, health insurance, housing, quality education. In order to prevent violence, we really need to look at the root causes and start to shift the landscape there. At the same time, just like Brian showed in his slide, here in the Office of Public in Violence Prevention, we have a 3-pronged stool of prevention, intervention, and healing, believing that all 3 simultaneously are important. As you pull people out of the river to, as they need help, you also need to go upstream and see why they're falling in the first place. So our strategies are geared around that 3-pronged stool of prevention, intervention, and healing. Now, I'd like to share a little bit of data with you, and then I'll dive into our gun safety initiative specifically and the resources that we have for you. So if I can have the next slide. I want to share a little bit of data. So we start here, this slide and you will have access to all of these slides. But here this graph shows you firearm mortality rates in the US, California, and Los Angeles County from 2013 to 2022, a 10-year period. And what you see here is the blue line is the US, much higher rates, 14.5 per 100,000 firearm mortality rate, whereas California and Los Angeles County are very similar, 8.9 per 100,000 for California, 9.1 per 100,000 for Los Angeles County. That is 2022 data, so it's a little dated. We now have access to 2023 data. So we'll be updating these numbers, but let me dive a little deeper for a minute into Los Angeles County. Next slide, please. So here are trends in firearm deaths by intent, firearm homicide, firearm suicide, other firearm death. Firearm deaths, as we count them, include unintentional injuries, deaths through legal intervention, lethal use of force by law enforcement, and homicides and suicides. And what this shows you is that firearm homicides increased 64% from 2019 to 2021, but decreased in 2022 and 2023. So we're starting to see those numbers come down. The number of firearm suicides increased 16% from 2021 to 2022, but then decreased in 2023. So those numbers are coming down a little, but you can see a much more steady line. And then the last is other firearm deaths, the other ones that I mentioned to you earlier. Next slide, please. This slide shows you the rate per 100,000 of firearm homicides and suicides by demographic group between 2018 and 2022. And we know that firearm violence affects all communities and people in Los Angeles County. However, men, and particularly young men of color, are disproportionately impacted. The firearm suicide rate for older adults is almost twice as high as the county rate. And here you can see the overall rate for firearm suicide is 2.6. For older adults, 55 plus, it's 5.1, so almost twice as high. You can see that um, whites have a rate of 3.6. So again, older white males are disproportionately impacted. We know that for suicide attempts, that data looks a lot different. And then for firearm homicides, the rates that the demographic groups impacted are a lot different, with Black males showing rates that are 3 times as high as the county rate. Next slide, please. So we know, and you've heard from the prior speakers, that gun violence is pervasive. It affects the entirety of Los Angeles County to varying degrees. And this map just shows you the darker spots are where there are greater rates of firearm violence. But we know that for deaths are the easiest to count. And so we can easily capture that number. We get that from the coroner, the medical examiner, we get the number of deaths. And then we see the hospitalizations are a greater number than that. And then there are numbers that go unreported, or shots fired in neighborhoods that have the impact of trauma that Brian and Trouty were talking about. Like, when exposure to gun violence it can cause trauma. And so we know that the impact, we know the number of deaths, but we know that it's really that pyramid, and that there are many people who are impacted when gun violence occurs. In 2022, the direct cost of firearm violence, healthcare, law enforcement, our team estimated, or used data to estimate, is more than $600 million. Next slide, please. This last slide I just want to show and focus in, because we're doing a lot of, we have a campaign now with Los Angeles County Medical Association and LA Care that really focuses on preventing child firearm deaths, 0 to 18 in LA County. And this just shows the number by year. And the unfortunate thing is that we see those numbers increasing in 2023. There were 60 child firearm deaths in LA County in 2023, a huge increase from the 40 that you see the year before. So we're investing a lot in doing campaigns and spreading the word about how to prevent child firearm injuries and deaths. Next slide, please. So how are we doing that? And I know I'm keeping track of time, so I have just a few more minutes left, but I just want to go quickly. You'll have the slides. In 2022, after yet another series of mass shootings, our director, Dr. Ferrer, came to us and said, we need to do something more. And so we worked with our county and community partners to develop a gun violence prevention platform that really focuses on 4 priorities. And that is advocating for robust gun safety legislation, promoting social connections, healing, and a culture of peace in neighborhoods, improving awareness of and access to restraining orders, and then also working with the schools to increase access to resources and mental health supports for school-aged children. And we invested 5 million of our American Rescue Plan dollars into those services in 5 districts. So that's our 4 priorities as part of the platform. Next slide, please. As part of this, we have a gun safety initiative. We purchased 60,000 firearm gun safety locks. We are working with the Department of Health Services. We're in 6 of their medical centers. We're working with our LA County libraries. 5 libraries have tool lending libraries that now also distribute our free gun safety locks. So this is part of the campaign that I talked about with LACMA and LA Care, huge billboards that went on about the county, just trying to increase awareness about, the access to firearms, the impact. We had the campaign every 30 hours in LA County, a child is killed by a firearm. So our purpose here is really to distribute as many of the gun safety locks as we can. Anybody can go online to that website, lacountygunsafety.org, leads them to our website where you can get 2 gun safety locks free, no questions asked, along with some educational materials sent to you. Or you can go to any one of the 6 DHS sites, which are on our website, or the 5 county lending libraries, and they will give you 2 free gun safety locks, free, no question. And then we want to partner. We want to partner with people like NAMI and LA Care and others to get those gun locks out to as many people as we can. So far, we've distributed 25,000. Again, like I said, we have 60,000. If you're interested in gun lock, you can go either to our website or you can reach out to me. My information's at the end. And if you have some kind of an event or health fair or and you want us to show up, we will, or we can get you some free gun safety locks to distribute. Next slide, please. This is just part of our education and awareness campaign, some of our materials. Next slide. Because I want to spend a minute right here talking about gun violence restraining orders. So Brian said I would talk a little bit more about this. So gun violence restraining orders are part of a 2016 California law that went into, or a law that went into effect in 2016, also known as red flag law or extreme risk protection orders. In California, they're known as gun violence restraining orders. This legislation went into effect in 2016, and it's a tremendous tool to prevent gun violence, to save lives, and yet it's drastically underutilized. So Hope and Heal and others, ourselves, are trying to increase awareness about this tool. And gun violence restraining orders are very helpful if a person who has access to guns is in crisis and showing signs that they might hurt themselves or others. It's a tool for civilians to use and to stop someone from having, owning, or buying firearms, firearm parts, ammunition, or magazines. These can be obtained by petitioning the court, by police. Law enforcement typically has done this, and most of the gun violence restraining orders in LA County are through a petition by law enforcement. But what this legislation really did was allow others, like family members and partners, housemates, employers, colleagues who work closely with someone, and school officials, teachers, and others, to, if they see signs, and people are the ones on the front line that are going to most notice signs of someone in crisis, then they can petition the courts for a gun violence restraining order. It removes the guns or ammunition for 21 days and up to 5 years for individuals who are at risk of harming themselves or others. Next slide, please. And so what we do is we have a huge campaign that's going on, and it's going on throughout LA County to raise awareness. There are flyers and posters available from OVP. But what we did when the board asked us to do this and increase awareness, we said, look, awareness is one thing, but helping people navigate the system to obtain a restraining order is another thing. And so we asked for 2 staff who are system navigators who provide education, do outreach and training, but they will support anyone who's trying to get a gun violence restraining order and trying to go through that court system. They're not going to do it for you, but they will walk alongside you and help you navigate that system. And so that information is here. Again, it'll be in the slides that you get as at the end of this webinar. But please do not hesitate to reach out. And if you or someone you know is interested in obtaining a gun violence restraining order and doesn't know where to begin. Next slide. I think we'll only have 1 more minute. We also, like NAMI, have trauma-informed care resources on our website. We have pamphlets and brochures and things that you can use. This one was right after Monterey Park mass shooting. We did this to distribute. We have it in multiple languages, I think up to 12, to how to support children after a public act of violence or community tragedy. So those resources are up on our website. You can feel free to access those as well. Next slide. So there's many ways to get involved. And I just want to reiterate the message that please, we are your LA County Office of Violence Prevention. Whatever data we have, we want to share with you. Whatever tools we have, we want to share with you. There are free gun safety locks available to individuals as well as for larger events and programs. And do not hesitate to get in touch with us. We're here to support. The gun violence is preventable, and it takes all of us to be involved in that effort. So however we can support you in that, we would like to do it. So next slide. I think that's the end of my presentation. Thank you very much.
Thank you, Andrea. Really appreciate your time. We're gonna do a poll question here. Do my folks, are you ready to get the poll question up? There it is. After what you heard tonight, if necessary, do you think you would support an individual or through law enforcement filing a gun violence restraining order if someone was threatening violence against others or self-harm, just on what you've learned tonight? So take your time, answer that. I also really wanted to address, like, again, this is a lot of really heavy data and a lot of heavy information. But I really want to assure you, speaking for myself, who's been doing this for 30 years, as Andrea just said, this gun violence and firearm suicide is completely preventable. And the stuff that we're talking about tonight, especially making sure that your county behavioral health system or your hospital is screening for firearms, making sure that people know that gun safety locks are available is super important. These things may just sound like, well, we'll just kind of try that. These things really will work. And also, speaking as somebody who's been in sort of the greater gun violence prevention movement for a long time, is things like suicide and firearm suicide have not been talked about. They've been sort of buried. And so right now, I think a lot of people are really starting to talk about it. And the solutions that we're offering, and there'll be more, there's ways to innovate. There's more. We had another hour, we could talk about some of the innovative things going on. I just wanted to express to everybody that hope is in our name, Hope and Heal, and that the solutions are there. This is all very preventable. But anyway, please answer the poll question. We'll leave it up for there for a few more minutes. But in the meantime, looks like we have some good questions coming in. So I'm going to move down to those. Give me just a second. But along the lines, before we get to the questions as well, I just want to recognize that we know NAMI is a critical stakeholder, and we want to inform you about gun violence restraining orders. And certainly we can provide you with more information about what those are and how they work, because it is an important tool. It's not the only tool, but an important tool to reducing suicides. But again, I really want to stress, and as NAMI members, you guys are great advocates, that to really check in with your behavioral health systems. Could be a college, it could be a university, it could be community college, right? The behavioral health system could be a private hospital. Find out if they're doing these screenings. And if not, we'll provide you with this sort of decision tree and interim protocols, and we'd be happy to partner with any of you and with the Office of Violence Prevention to make sure that they understand what these protocols are for and how they can really save lives. Because we're finding very limited systems, behavioral health systems, mental health systems that have such a protocol. So I just want to put an exclamation point on that. And again, that gets back to, we know that suicides are preventable and firearm suicides are preventable. So with that, I'm going to dive into the questions, and I know we have a few here. And this is, I may answer a question. I know Trouty and Andreas, feel free to jump in as well. The first question is, could you address considerations for self-harm risk for primary care providers treating patients with SUD, especially opioid use disorder? So I don't know if Trouty or Andrea want to take that. Is that something you feel is in your wheelhouse? Do you want me to repeat? I can repeat the question as well. Would that be helpful? Okay, because it's a long one. Could you address considerations for self-harm risk for primary care providers treating patients with SUD, especially opioid use disorder? So I don't know, and if we're not able to answer that question, we can certainly find someone who could, and we could have that question answered at another time. But I just wanted to put it out there to see if either of you might take a stab at it, or we can make sure we do something, a written response afterwards. I know Kuko from our team actually was going to chime in here. So is that okay, Trouty? Did you want to jump in, or you want to? Oh, Kuko. All right. Well, Kuko, jump in. Go ahead, Kuko.
Hi, everybody. I think it goes back to, I think, the fundamentals that we know in mental health, which is, and I think Brian spoke to it, I think Andrea as well, and so did Trudy, which is, it's a combination of things. It's not just one thing. It's just not substance use disorders, if it's opioid or it's other things. It's a combination of, and that's, I think, where the screening comes in. The worst case scenario, I think, for us in this work, be it a homicide or a suicide, is a combination of things, which is you have a trauma, a mental health condition, treated or untreated, combined with alcohol and drug use. That begins to escalate the problem and create a bit of a crisis. You compound that by introducing a crisis or a significant life change. That already is a very huge problem for individuals struggling with all of that in terms of a crisis. But now you include in that access to a firearm, and now the lethality increases considerably. So I think for any system, and I think that that's part of our focus, any system that has high contact with vulnerable populations in terms of suicide or homicides, it is important to screen and to understand whether or not they have access, especially during those vulnerable moments. The time frame in terms of impulsivity, especially for suicide, I believe that there's a 5-minute window from impulsivity to execution for folks. So it's real important to extend that window. It's also important to identify whether or not people have access to firearms, because you can deal with a crisis that combines alcohol, drug use, trauma, or mental health disorder, and in a precipitating event. It's very difficult now when you add the access to a firearm in terms of lethality and time. So I'm hoping that answers your question, especially, again, and it's not limited just to mental health, public health. I think it's limited to, it should be inclusive of all systems that have any contact with vulnerable populations.
Thank you, Kuko. Thanks for jumping in. Appreciate it. We have another question here, and I think it's a question about pending legislation at the federal, state, and local LA County level. And of course, Andrea, I can maybe turn it over to you to kind of any sort of updates you might have on LA County firearm safety legislation. But I think the question is centered around uh, uh, assault weapons, trigger locks, selling guns out of trunk. I think that gets to the gun access piece. I mean, the one thing I don't want to spend too much time on legislation, but as someone who worked for the Brady organization for a long time, we know that California has in fact, the strongest gun safety laws in the entire country. We do know that if strong gun laws were the answer, we would be near zero firearm deaths, and that's not the case. So that's not to say the firearm laws don't work. It's just to say that Hope and Heal, with Office of Violence Prevention, NAMI, there's so much more to do that are outside the halls of the state legislature and Congress. But as for kind of addressing, like, California has an assault weapon ban on the books. Folks do get around it fairly easily by making modifications. So it's up to the legislature to kind of keep up with that. Trigger locks are required. Gun safety locks are required at the purchase of every federally licensed dealer. That doesn't mean that, you know, people use them or can't speak to the quality of them. And that's why it's important that what Andrea and Office of Violence Prevention are doing is really important. And for selling guns out of the trunk, right, that we know that is illegal. In California's very strict laws about becoming a licensed dealer and selling out of a store or brick and mortar. But there are strategies, and for whoever asked that question, you know, when you get the slides, please contact us. We can talk a little bit more about kind of our strategies to decrease access in the community for illegal guns. And I don't know if Andrea, if you wanted to talk about anything from your perch in terms of pending legislation.
No, I think organizations like Hope and Heal, Giffords, Brady, you know, in terms of legislation, like you said, Brian, California has some of the strongest gun laws on the books. I think it is that question of enforcement. And I think we're about to enter into a new environment in terms of that, and just holding on to make sure that we elevate the issue of gun violence and do whatever we can. No local legislation that I'm aware of at this time, but I think HHS just removed the gun violence public health advisory. So I think there's a lot of work to be done ahead of us. But no, I think you guys you would be the source to go to in terms of the legislation.
Okay, wonderful. Thank you, Andrea. We had some questions from when folks are registering too. So here's a question. Are there any nonprofit organizations that can help families file pro bono for a GVRO in Los Angeles County? I don't know if this kind of gets to the navigator question. Andrea, do you have any?
So I think that to help file pro bono, I think what our system navigators, I would say reach out to our system navigators, because they can help you. We could find out what those resources are. They may know what those resources are, or they can help to identify how someone could get pro bono services. I don't know the names of organizations right off the top of my head, but that's what the system navigators are there for. So I would encourage the participant to reach out to us and contact us to get linked to a system navigator.
Right, great. There is a question here about gun violence restraining orders, the law and how they're enforced. This is when the NRA and Trump administration appear intent on dismantling common sense laws. I could address this. First of all, one of the things about gun violence restraining orders, or as Andrea said, also referred to as extreme risk protection orders in other states or red flag laws, these are state laws. These are not federal laws. So in terms of the purview of dismantling these, I think it'd be pretty tough to do because these are, again, our state laws. These are not federal laws. I also would like to just add on that a gun violence restraining order is a civil order. It is not a criminal order. So this is not something that's putting someone behind bars. This is not criminalizing anybody. It's temporarily preventing access from a firearm. And again, it's a civil order. And so no one's going to prison, no one's going to jail. It's just separating somebody from a firearm if they're intent on harming themselves or others. So I really wanted to make that clear. There is a question, I don't know exactly what the context of it, but maybe Trouty or Andrea, you might. It is, what is the role of the addictions counselor and mental health nurse practitioner or psychiatrist? So I don't know if that's not enough context for you all, or you might understand where that question might be coming from.
I do not, we do not use it. We don't work with addiction counselors. So I don't know, Trouty, if you have any information on that.
Yeah, I think we need a little more information on that question.
Okay, fair enough.
Could I offer a little something?
Yes,
Oh,
please do.
Kuko, you go, Kuko.
You know, I think this, and I apologize, I'll keep jumping in here, but it speaks to what Brian has kind of alluded to, which is, you know, within behavioral health now, which is now an integrated system or will be, these are things that have been largely absent when you don't identify firearms. So a lot of what you're talking about is a new role for folks. You know, for us personally, I would akin GVROs and firearm identification similar to mandated reporting, you know, in terms of it's just a standard practice. Why it's not a standard practice in the one system that has the highest concentration of people that are vulnerable to suicide, and they're not identifying whether or not they have access or own a firearm is beyond me. So to your point, I think that it's not only the role of any addiction specialist, it's any caseworker, any peer, any family member within mental health systems and other systems. Again, I go back to this. This is a shortcoming within multiple systems across the spectrum, right? That have high contact with people that are vulnerable. If somebody came to you and said, I feel suicidal, we would hopefully know what to do and have protocols in any system, that would be at a school, be it other places. At the same time, if we know that somebody is very vulnerable and struggles with depression or suicidality, and we also know that they have a firearm, wouldn't we become far more aware? Wouldn't our treatment planning look a lot different? Wouldn't our crisis planning look different? Look, fundamentally, at the very end, if we go to the VA system, they assume everybody owns a firearm. And therefore, their treatment planning and their crisis planning looks a lot different than our traditional public health system, public mental health system. So I think to your point, I think that the role not only of addiction specialists, but caseworkers, anyone across the whole spectrum is a needed remedy, I think, for public health, mental health, and other systems that have high contact with individuals who struggle with issues of suicidality.
Thank you, Kuko. Questions are still coming in, so I'm seeing a few more. What are the consequences of violating a gun violence restraining order? That's, I don't know, Andrea, do you want to jump in there, or I'm happy to try to answer it, but.
Brian, I defer to you because, yeah, if you have,
Well,
because,
yeah.
I think there's
ahead.
two, like what happens when you violate a gun violence restraining order, and I think that's that one piece of it. And but I would defer to you. But I think what I want to say here too is we're looking at other mechanisms, like we're reaching out to firearm dealers to find alternate ways to store weapons when someone's in crisis, um, to steer clear of a more penalized approach. I don't know what that looks like actually when someone, how often that occurs, or what that looks like when someone does. But I think that's part of the stigma and reasons why many communities and communities of colors do not want to use the gun violence restraining orders, because they fear that it will further penalize or criminalize their loved one, when what they want in reality is that gun to be taken away while that individual is in crisis. So I'd just say that we're aware of that, and we're trying to work with firearm dealers to understand where there are alternative places, Because again, as you and Trouty said, it should be when someone is in crisis, what is the support and how can we lean towards other options besides engaging law enforcement when needed. But other than that, are there other ways in which we can help support an individual in crisis without perhaps further criminalizing that individual? So I'll just
Yeah.
say that and turn it over to you.
Yeah, no, I think that's really important. I think it's also important to know that gun violence restraining order it's not just the guns that you own will be temporarily removed if there's a gun violence restraining order, and usually that is done by law enforcement. They're the ones who are going to remove the firearms. The other thing I would say too is that someone may not own any firearms and you still want to get a GVRO against them. What that means is you don't want them to go out and purchase a weapon. So what happens is while the GVRO, gun violence restraining order, is in place, you are prohibited from buying or purchasing a firearm, right? So it's not only the guns that you have must be surrendered temporarily until the crisis passes, but you also are not allowed to purchase a firearm. You will not pass a background check until that gun violence restraining order has expired. I would also like to say too that we're not here saying the gun violence restraining order is the end all be all to firearm suicide prevention. It is, I would say, a narrow but incredibly important tool that can be used. I will also say too that we work with a lot of folks from around the country and other places who, some gun owners they're not really like, I don't want the gun violence restraining order. Like, what are the other options? There are a lot of other options being explored, and these are with veteran groups, these are with your hunting buddies, right? Is, you know, having your friends and people around you recognize that you're in crisis and say, Bob, I know you love your hunting rifles, but you've been drinking a lot, you seem like you're in crisis. I know how much you love your firearms. Can I hold them? Can I get them to a dealer, a firearm dealer, or a range that is going to participate in voluntarily storing that firearm? Right. So it's not just like if you hear like, oh, gun violence restraining order, in some cases that may work. And if the crisis is imminent, there's an emergency gun violence restraining order, right? That if time is of the essence. But if there's an ongoing crisis or something friends and family are noticing, we're really exploring other ways to voluntarily relinquish that firearm, right? And I even met, Kuko and I met somebody, a veteran from a veterans group down in San Diego, basically said, this was his spouse, and she said, when my husband, is in a crisis moment, he gives me his firearm saying, you need to hold these. So there can be a recognition on the person in crisis, but there also must be a recognition of the people surrounding that person in crisis, like, oh my God, it's only a gun violence restraining order. What do I do? Yes, it's important. Yes, it's critical, but it is not the only solution. So I wanted to make sure that folks know that we're exploring, and I'm sure the Office of Violence Prevention is too, exploring all kinds of ways that firearms can be temporarily removed from the person in crisis. Kuko, did you want to jump in?
Yeah, only because I want to make sure that because I think Andrea raised a really good point, and I think that especially for NAMI members, because you are on the ground and working with multiple systems. To me, this is a clear example of a fine line that we have to navigate sometimes, where communities of color may not utilize this because of their distrust of systems and language, immigration, other things. At the same time, it also is a very clear, to me, it's very clearly evident that this also shows the disparities when we talk about inequality and how we apply laws, where you want to put the responsibility. Let's say I have a GVRO against me. I have a legal purchase gun. It was removed. I can't purchase it anymore because that's what's been instituted. I go out and I purchase an illegal firearm, right? All of the onus and responsibility falls on me for violating that. When in reality, 5% of gun stores are responsible for 95% of all illegal firearms found in crime scenes. And where is the responsibility that falls and the onus on those gun stores for making that readily available? At the end of the day, from our standpoint, in terms from a broader kind of analysis for Hope and Heal, we really have to question why firearms are so readily available in Black and Brown communities and not in other communities to young people, particularly, or other people that aren't supposed to have access, but particularly to young people. And I think that while we make the end user the responsible party, what we're ignoring is laws that are equitable or also holding accountable legal businesses that are engaged in questionable practices. And the data shows that. So I really want to highlight that because I think that this is a a broader kind of conversation about equity and advocacy and support and allyship in terms of organizations and how we look at this issue. So we're not just making it about stigmatizing the end user or the mental health client or whoever it is that is who has lost their right to own a firearm. I think that there's a lot more we can do to hold other systems players accountable for this and what they contribute.
And I'm sorry, I know you probably want to go to the next question, but to build off what Kuko you said and Brian, I love this because it's also about the support, the mental health support. So there are other options. The GVRO is a tool, but how great would it be if law enforcement did show up, but they showed up with the mental health or mental health, like the resources are a very critical part of this as well. And I think there's a lot that we're learning as we go along in terms of the populations that we're trying to reach, really honing in. And it's about the support as well as a tool to take away a firearm temporarily.
Great. Thank you, Andrea. Thank you, Kuko, as well. We have another question. I think could be the last question, unless one pops in. Would a gun violence restraining order appear on a background check that an employer might run or a landlord might run? The answer is no. The background check system, if you're in the prohibited list for purchasing a firearm in California, it is in a separate database that is only available to California DOJ and firearm dealers. Even to firearm dealers, they just know that someone has come up prohibited. It won't tell them why, it won't tell them any of that. And this is not a universal database that is accessible to landlords, employers, or anybody else for that matter. It's basically for the Department of Justice to run, the Bureau of Firearms under the Department of Justice. And then the firearm dealer just says, you came back as prohibited. It doesn't say why, it doesn't say you have a GVRO, because we certainly do not, the idea is not to stigmatize people. The idea here is for people to seek help and get help. So I just wanted to make sure that folks understood that. Again, it's a civil order, not a criminal order. It's a temporary prohibition until the GVRO expires and is not accessible by anybody except the California Department of Justice and the firearm dealer. That's it. And just seeing if there's any more questions. These are really fantastic. I really appreciate all the questions. I'm not seeing any more questions. I'm just double checking here. Before we wrap up, we have a couple minutes. Trouty, did you want to wrap up, or is there anything that you wanted to say as we wrap here?
Yeah, I think, I just want to comment on that. It's important to ask the question if you're concerned about someone and to ask directly about suicide. Don't be afraid because, if you don't ask, you may not get to the root of if someone's in distress, and you could save a life. And, if you also ask if someone has a plan, then you would know if it's imminent or not, and also the means. So, we've talked about guns and suicide, but, if someone might use, pills or medication in the house, it's important no matter, if someone has a plan and they've identified how they're going to do it, to remove those means from the house, or, make sure they're locked up. And also, putting that time and distance between someone and the means that they're going to use, because that suicidal ideation can go away, sometimes in matter of minutes or hours. So it's really important, if you're worried about someone, not to be afraid to ask directly, are you thinking about suicide? And if they say yes, when were you thinking of, doing it, or how were you thinking? And if they have the answer to those two questions, then you need to take action, and you need to, direct them to help. Don't leave them alone. If they have a plan and a means, do not leave them alone. Call 988 and, or take them to, an emergency department or a mental health facility. So I just want to, say that. And also, again, thank you so much to Brian and Andrea and everyone who's, been participating, and everyone who's attending. And, I hope everyone practices self-care this evening, because it is a very difficult subject matter.
Thank you, Trouty, and thank you, Andrea. I really appreciate you both, and really appreciate NAMI of Greater LA. It's been for helping us pull this together, and all of you for listening. And again, I'll second that, Trouty, like really challenging and difficult, but there are solutions, and they're innovative solutions, and they're solutions that don't involve a GVRO. So I'm very optimistic. I feel like we're finally talking about this issue of suicide, not only just suicide, but the most lethal means of suicide, which is the firearm. And it's really important. As difficult as these conversations are, it gives me hope that, we can really, turn this around and really see massive reductions in the amount of firearm suicides that we see. So Andrea, thank you. Trouty, thank you. Thank you to my team at Hope and Heal, and Kuko for jumping on for all the great work and supporting this. And again, I know we'll make this presentation available to you all. Again, how to get in touch with Trouty, how to get in touch with Andrea, how to get in touch with me, and Kuko at Hope and Heal will all be on the slide. So please do reach out. We're here for you all. And we if you have different ideas and different things that you'd like to discuss with us, don't be shy. You know where to find us. And with that, I will say good evening. Thank you again for spending your dinner time with us. And we look forward to hearing from you. Thanks again. Have a great evening.